What early signs should women look for regarding HIV/AIDS? Maria never expected her life to change so drastically in just a few months. At 28, she was a successful marketing executive, engaged to be married, and looking forward to starting a family. But a persistent fever and unexplained weight loss sent her to the doctor, where a routine HIV test revealed a shocking diagnosis. Maria was HIV positive. Looking back, Maria realized that there were subtle signs she had dismissed. Fatigue that went beyond her usual work stress, night sweats that left her sheets damp, a nagging sore throat that lingered for weeks. These symptoms, seemingly innocuous on their own, painted a different picture when viewed together. Maria's story is not unique. According to the World Health Organization, women account for more than half of all people living with HIV globally. In 2022, an estimated 19.5 million women were living with HIV, highlighting the critical need for awareness and early detection. For women like Maria, recognizing the early signs of HIV can be challenging. The virus often mimics common illnesses, making it easy to overlook. A study published in the Journal of Acquired Immune Deficiency Syndromes found that women are more likely than men to experience early HIV symptoms, yet these symptoms are frequently misattributed to other conditions. One of the first signs Maria noticed was a flu-like illness about 2 weeks after a potential exposure. This acute HIV infection phase can include fever, chills, and body aches. Research from the National Institutes of Health shows that up to 80% of people with HIV experience these symptoms, but they're often dismissed as a common cold or flu. As the weeks passed, Maria's body struggled to fight the virus. She developed swollen lymph nodes in her neck and armpits, a sign her immune system was working overtime. A study in the journal AIDS Patient Care and STDs reported that persistent lymphadenopathy is present in up to 90% of HIV-positive individuals during the early stages of infection. Maria's weight began to drop without explanation. She lost 10 pounds in a month, despite no changes to her diet or exercise routine. Unintentional weight loss is a hallmark of HIV progression, with research in the journal Clinical Infectious Diseases showing that it affects up to 14% of people with early-stage HIV. Skin changes were another subtle indicator. Maria noticed an increase in skin rashes and unusual blemishes. A comprehensive review in the International Journal of Dermatology found that skin manifestations occur in up to 90% of HIV-infected individuals, often appearing early in the disease course. Night sweats became a regular occurrence for Maria, disrupting her sleep and leaving her feeling drained. These episodes, along with persistent fatigue, are common in early HIV infection. A study in the journal PLOS1 reported that up to 66% of people with HIV experience severe fatigue, which can significantly impact quality of life. As her immune system weakened, Maria found herself catching every bug that went around the office. Recurrent infections, from yeast infections to sinus problems, are red flags for HIV. Research published in AIDS Research and Therapy showed that women with HIV are particularly susceptible to vaginal yeast infections, with rates up to 10 times higher than in HIV-negative women. Maria's experience underscores the importance of regular HIV testing for sexually active women. The Centers for Disease Control and Prevention recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare. For those at higher risk, annual or more frequent testing is advised. Early detection of HIV is crucial for better health outcomes. A landmark study in the New England Journal of Medicine demonstrated that early antiretroviral therapy reduced the risk of transmitting HIV to uninfected sexual partners by 96%. Furthermore, starting treatment early can prevent the long-term complications associated with chronic HIV infection. Maria's journey with HIV began with subtle signs that were easy to dismiss. Her story serves as a powerful reminder for women to pay attention to their bodies and seek medical advice when something feels off. While the symptoms of early HIV infection can be nonspecific, being aware of the potential signs and understanding personal risk factors can lead to earlier diagnosis and treatment. In the years since her diagnosis, Maria has become an advocate for HIV awareness and testing. She encourages women to take charge of their sexual health, have open conversations with their partners, and never hesitate to get tested. Her experience shows that HIV can affect anyone, regardless of background or lifestyle. Bonus: Maria's situation reflects a common scenario, highlighting the critical importance of understanding HIV testing options, particularly for women. The World Health Organization reports that women make up over half of all individuals living with HIV globally, underscoring the urgent need for effective and accessible testing methods. Since HIV was first identified, testing techniques have advanced significantly. Today, we have several dependable options, each with its own merits. Let's explore the most effective tests available for women like Maria, keeping in mind that early detection is crucial for optimal health outcomes. The combination antigen-antibody test stands as the gold standard in HIV testing. This test searches for both HIV antibodies and antigens in the blood. Antibodies are proteins your immune system produces to fight HIV, while antigens are components of the virus itself. A study in the Journal of Clinical Virology revealed that this test can detect HIV as early as 18 to 45 days post-exposure, making it one of the most sensitive options on the market. For women seeking a less invasive method, the oral fluid antibody test offers an alternative. This approach uses a swab to collect oral fluids from the gums and cheek. While convenient, it's worth noting that this test may not detect HIV as early as blood tests. Research published in AIDS Patient Care and STDs indicated that oral fluid tests can reliably detect HIV about 3 months after exposure. Rapid HIV tests have transformed the screening landscape, delivering results in as little as 20 minutes. These tests utilize a small blood sample from a finger prick or oral fluid. A study in the Lancet HIV journal found that rapid tests boast a sensitivity exceeding 99% when performed correctly, making them a reliable choice for many women. For those worried about very recent exposure, the HIV RNA test offers a solution. This test detects the genetic material of the virus itself and can identify HIV as early as 10 to 14 days post-exposure. However, it comes with a higher price tag and isn't as widely available as other options. It's vital to understand that all HIV tests have a window period, the time between exposure and when a test can reliably detect the virus. For most tests, this period spans about 3 months. During this time, a person can be infected with HIV but still test negative, which is why follow-up testing is often recommended. As medical science advances, living with HIV has become more manageable than ever before. Early detection and treatment can lead to a near-normal life expectancy and significantly reduce the risk of transmission. Maria's story, though challenging, is ultimately one of hope and resilience. For women watching this, remember that knowledge is power. Understanding the early signs of HIV, staying informed about your sexual health, and regular testing are your best defenses. Don't let fear or stigma prevent you from taking control of your health. Maria's journey shows that with early detection and proper care, a diagnosis of HIV is not the end of the story, but the beginning of a new chapter.